Good afternoon, everyone. I am going to kick this off. Actually, we both are going to kick this off just by sharing a little bit with all of you why Brandy and I, although trained in very different fields, have come together, have partnered on this important topic that we're going to present to you today. And so we wanted you to know about the National Working Group in the United States that we are both a part of, and to let you know that we are a very diverse yet very welcoming group, that we, in fact, just had a working group meeting a few hours before this. And we have taken on a number of tasks, but one of our primary objectives this year, as last year, is to address what Brandy and I are going to present here today. Brandy, do you want to add to that?
Yeah, the only other thing I would add, is that this working group's a mix of about half industrial hygienists and OEHS professionals and about half working museum professionals. You do not have to be an AIHA member to be part of our working group. So if you do have any questions or want to participate, my contact information will be at the end. Feel free to email me and I'd be happy to connect you to our active group.
Thank you, Brandy. So to begin our presentation today, we have to back up and think about how museums around the world and the collections that they currently hold came into being. And so it's important to think about the historical past and the legacy of colonization. Many collections around the world were built through the process of colonization. Objects that are currently housed in national museums around the world are now being called into question in terms of what we should rightfully, both ethically and legally, have in our museums throughout the world. And so thinking about how, for example, here you see the Smithsonian Institution in Washington, D.C. You see in the interior shot, exhibit case after exhibit case, chock full of artifacts. So we need to understand that while we have a much stricter way of building and defining museum collections today, in the past, museums routinely took everything that was offered to them. And there was also this, what I like to tell my students was sort of a Ripley's Believe It or Not approach to collecting. That was, it was okay to have 2 spear tips from Papua New Guinea, but 2,000 on a wall had a much bigger wow factor. So we have to remember that it was, that collecting in the late 1700s and throughout the 1800s was couched in a history of colonization, colonial approach to everything in terms of museum policy, but also that there was this idea that the more of anything, the more interesting your museum collection was. Next. And so, of course, this is the case for museums throughout the world. I use the example of the New Brunswick Museum because it's one of Canada's oldest museums, and as I understand it, it is considered Canada's oldest museum in terms of continuous operation. But it's another example, like the Smithsonian Institution or the British Museum in London, of very large museums amassing these tremendous collections over a span of many, many decades. Here, the museum boasts of hundreds of thousands of plant and animal specimens, and highlighting some of their more unique collections, a parakeet from 1869 that is now extinct. So large numbers of natural history collections, which in a little while we're going to talk a little bit about why that's relevant to all of you in Canada in terms of understanding Canadian museums, both in the past and in today. Next. So thinking about natural history collections, but also ethnographic collections, we're talking about organic materials. So for cultural materials, feathers, furs, skins, these are all protein-based items. So from the perspective of a pest, particularly North American pests that are proteinaceous feeders, that is, they're seeking protein, that's how they feed, then all of those natural history collections, all of those specimens, all of those ethnographic objects, indigenous made objects that contain feathers and furs are particularly vulnerable to pest infestation. And in North America, we have roughly a dozen pests. Probably that's changing with climate change. Probably we will be upping that number, but roughly a dozen, what we call the dirty dozen in the museum field. And the dirty dozen are the insects that target museum collections because they're proteinaceous feeders. So for a very long time, museums who are charged with caring for collections in perpetuity have solved this problem by applying pesticides. And throughout the 1800s in particular, arsenic and mercuric salts were applied to natural history specimens and indigenous made objects to prevent pest infestation. Arsenic, for example, was applied in more than one form. It was applied in soap form. It was also applied as a liquid to the exterior, and we find it in powder form, particularly in natural history specimens, on the insides of those prepared skins and specimens. Whether it's a stuffed lion or an ornithology mount, the white powder was mixed with other kinds of materials that were used to actually stuff and shape that particular specimen. Next. Of course, the problem is with indigenous communities today that as nations around the world recognize the history, the colonial past, and the fact that not all objects made and used by indigenous communities should be in a museum, they are now returning these items to indigenous communities. And this is something that at the time of repatriation becoming commonly understood around the world, people weren't really thinking about the fact that these returns were potentially harmful to living community members. Repatriation work is grounded in social justice, but not a lot of museums stop to think about the fact that these returns were putting these harmful chemicals back into the hands of community members. And in some cases, they go into tribal museums. But in other cases, sacred objects and even ancestral remains are either returned to the ground or returned to ceremonial life. Next. Interestingly enough, even as early as the mid-1800s, the general public understood, both in Europe and in North America, that there were certain hidden hazards in the materials we made and used in our homes. And so things like felted hats, wallpaper, historic wallpaper, there was an understanding that these things, either by the way they were produced or the way that they were treated, could be harmful to the general population. And I find that very interesting, that although that awareness is very well demonstrated through this particular wood engraving, that we were still, as late as the 90s, returning items to indigenous communities without asking the question, could these be potentially harmful to living communities? Next. So this is my first question for you. We're going to do a poll. What is the main difference between repatriation undertaken in Canada versus the United States?
We'll wait a little bit more.
Okay.
Take a guess, folks. So there are our results.
Okay.
Yeah, go ahead and
all right. Yeah, if you could advance to the next slide. So in the United States, the Native American Graves Protection and Repatriation Act came into being as a federal law in 1990. This was really a major shift in how museums and general audiences thought about repatriation. I will tell you that it has gone through several revisions. The most recent, the new regulations came out in January of this past year, and again have had a pretty profound impact on the way that museums think about repatriation, and most importantly, how they are now working with Indigenous communities to affect change. Next. So the answer to the poll question is that in Canada, there is no national or federal legislation regarding repatriation. There is no national heritage law. So those protections are looked at from a provincial standpoint, but the way that repatriation cases in Canada, at least currently, are undertaken is at the institutional level, and it's informed by the institution's policy. So when I talk to people about these differences, sometimes people think, well, if Canada doesn't have a national law and the US does, then the US is doing a better job of repatriation, and working with and for Indigenous communities. And that is not the case. In fact, I would argue, as someone who first started working on repatriation cases in Ontario decades ago, I think Canada was actually ahead of the United States, because they, decades ago, when a grave site or sacred site was identified or ancestral remains were unearthed, the Indigenous community in Canada was consulted immediately. It took the United States many, many more years to understand what true consultation is. So, the interesting thing about this is that there is a sort of an uptick in dialogue in Canada among museum professionals and Indigenous communities, that maybe it's time to re-explore the potential or the possibilities of a nationwide law in Canada regarding repatriation. Next. So repatriation, as I said, often involves returning items to communities. One fear that Indigenous communities around the world have with returned ancestors and their belongings, I mean funerary items, those things buried with them when their loved ones place them in the earth. There's fear that putting those ancestors and those items back in the ground could contaminate the soil, the earth where they grow their food. It could impact their water quality because of the museum chemical treatments. Equally concerning is the fact that for many Indigenous communities, and there are places in Canada where this is true as well, the items returned are sacred items, they're ceremonial items. And in this case, what you see is a Hopi community. Those sacred beings, what we call in English masks, are actually animate sacred beings who go back into ceremonial life, and they are kept in families' homes. Next. So question number 2, how does this contamination impact First Nation, Inuit, and Métis descendant communities?
I'll just end the poll. And there are your results.
Okay. Next. So the majority of you already come to this discussion today, understanding that when ancestors, their belongings, and sacred items are returned to Indigenous communities around the world, there is an impact to the living communities. There is a physical danger in terms of health impacts. There is a mental impact, which again, is the fear of getting this wrong and making the contemporary community unwell. And there is a spiritual. And of course, for most Indigenous communities, unlike the way that I separated it, which is a very Western approach to thinking about the whole person, they wouldn't necessarily dichotomize those aspects of well-being, that's understood. It's all one and part of the same. The head of repatriation at Te Papa National Museum in Wellington, New Zealand, a Maori man who is a colleague and friend, said to me, and this is his quote, Te Herakiki said that he realized there was a physical and health danger with engaging with ancestors who had been chemically treated. So he also indicated that there is a spiritual danger to bringing the dead back home. And many indigenous communities will tell you, we don't have a ceremony for reburying the dead, because when we place them in the ground, we never expected that someone would come along, dig them up, and put them on a museum shelf or put them on exhibit. So he's indicating that sort of holistic approach, but also that perspective that the impact is profound on many levels. Next. I want to give a shout out to the University of Manitoba. Their respectful rematriation and repatriation ceremony at the University of Manitoba is an absolute model for how to do things right. If you're not familiar with this particular initiative, I suggest that you follow this link or go to that website and read more about it. I could say so many things about the respectful way that they are approaching repatriation. One of the most beautiful things I've seen is a separate room. So elders in Manitoba said, until these ancestors go home, they need their own space where they won't be disturbed or where their descendant community members can visit them. And so they have what they call a resting room. And it's a beautiful space that Indigenous community members created and painted, low lit, but it has the same sort of feel that a chapel or a church space would have in terms of quiet and respectful reflection. Next. So I would just argue that until we fully address this problem of contamination in museum collections around the world, we are not decolonizing. As long as items are being returned to communities without awareness, without proper understanding of how to protect themselves, then we're not really decolonizing. In fact, we're upholding colonization. Next. I'll just say very quickly that Brandy and I, our working group, has worked with the Hopi Cultural Preservation Office. And in fact, our working group hosted at our national conference, the American Industrial Hygiene Association meetings year before last, a special gathering of industrial hygienists. And it was the tribal representative who's been dealing with this problem for decades who spoke to them about the problem in their community. Next. And then we, as a public service, went into the parking garage where the tribal representative had 3 sacred beings that had just been returned under NAGPRA. And we had the equipment and we had the expertise to test for heavy metal contaminants. Next. And finally, and the timing is perfect, if you're interested in this topic and want to learn more from the perspective of Indigenous peoples in Canada, this webinar is happening next week on September 26th. And you can go in and there's a place where you can register.
All right, so from here, I'll take over. Before I dive in, I'm going to talk a little bit about a project I worked on, which was called the Museum Poisons Test Kit, and then some of its applications to Indigenous tribes. But I did want to mention that there's been a recent news story down here in the US about this exact issue in all kinds of different museum settings. This particular case here deals with a natural history museum that was part of a zoo. And it had a lot of different taxidermy specimens. And their attorney basically was quoted as saying that no risk is acceptable. So they're going to be, it sounds like, destroying all of the taxidermied objects from this museum. I found that to be a little unfortunate. You know, there's a lot of different ways that these could be packaged or handled or moved that wouldn't necessarily involve having to be destroyed. So this issue is not going away anytime soon. So again, I'm going to be talking about the Museum Poisons Test Kit project. This is a project that I worked on with Paulette Reading, who's a textile conservator in private practice, and with Charlie Cook, who is also another industrial hygienist. One day we were sitting around talking primarily about different institutions that Paulette had worked in, and how, you know, she's often just given pieces of different textiles without any background information. And she was concerned that it might be impacting her personal health and all this other stuff. And so she wanted to know basically if there were ways to test for different pesticides and other contaminants. And so, of course, being industrial hygienists, our first thought was, well, you know, we could just take a small piece of the object and send it to a lab. They could digest it. They could run all these analytes on it, and we could find exactly what's on it. But of course, when it comes to museum collections and textiles and objects, they really don't want you destroying the object just to know what's in it. So we went back to ground, you know, back to the thinking board, and we were like, well, what if we just tested the dust that's been shed off the objects? In some cases, that's acceptable. In some cases, it's not. But for the purposes of this study, that's what we did, is we started doing wipe samples from underneath different objects so that people who don't have experience handling objects or don't want to directly test an object can get results. So as part of this grant project, we enrolled 4 different institutions into our study. These are the museums that participated. We had 2 different museums under the city of Greeley and 3 different community museums under History Colorado. Each institution provided at least 1 staff member to participate, as well as access to all their collections for testing. So just a little bit of background. When it comes to these, we particularly focused on heavy metals for this study. We had a limited budget. But when it comes to these kind of hazards for objects, there's kind of 2 different kinds. We've got inherent hazards and we have acquired hazards. Inherent hazards are those that are, you know, part of the object, basically. So those could be things like in a museum, you might have historic pharmaceutical collections that are hazardous, or they could be radioactive mineralogy specimens. Some of the mineralogy can be heavy metals themselves, like lead ore. And then we have some hazards that were deliberately incorporated during production. So we're talking about things like taxidermy has arsenic and chromates and the fixatives. Artworks were constructed with dyes and pigments, again, that contain heavy metals. We have a picture down here of a mercury felted hat. Mercury was part of the process. And then we have what we call acquired hazards. Now those came later, either through contamination from the use and storage, or, you know, through the application of pesticides, like Holly talked about earlier. These are objects that weren't intentionally hazardous, and they can acquire these, you know, in a lot of different ways. So then I have my next question. And just guess.
Well, that's probably close enough.
All right, so this is kind of interesting. So in Canada, according to a recent study published by your government, I found that the ratio prior to the pandemic was close to about 3 volunteers to every paid employee. In the US, that's actually closer to 6 to 1. And I also learned that roughly 20% of all cultural heritage institutions in Canada are completely operated by volunteers. So when we're talking about who's at risk for these objects that have pesticides on them, volunteers are a huge subset of people that can be put at risk. Volunteers work in all sorts of different ways, including cataloging objects, having hands-on, displays, docents, operating tours. We have volunteers, I know, in the US that work in archaeology and paleontology and in specimen preparation, cleaning, maintenance, just working around the objects, right? You could expose yourself to different heavy metals and pesticides. And then through this process and sampling materials and speaking with different institutions, we learned a lot about Indigenous communities being affected, again, by the use of these repatriated objects. And several of the tribal members that we have talked to saw a lot of potential benefits for this type of indirect testing. So, obstacles to testing. We've hinted on a couple of these early in my talk, but basically direct testing can damage objects. For non-experts, testing processes can be confusing. It can be hard to understand if you don't know the history of the object, whether or not these are inherent or acquired. They can cost a lot of money. And particularly when we're talking about Indigenous objects, we really, really need to be doing all testing with consultation through the tribe. So there are a lot of different methods out there, right? Portable XRFs, they're non-destructive, though it does require handling of the objects and knowledge of where and how to collect the tests. XRFs can be expensive, particularly when we're considering cultural institutions. They do require training to understand the results. Another option can be microchemistry testing, which and doing it through different tests. Similar limitations. So for this project, though, we divided into 3 phases. Our first phase involved increasing awareness about the hazards in cultural institutions. All of our different museum participants first completed a survey to understand their baseline knowledge of the topic. The pre-assessment also asked them to identify areas in the collection that they thought should be tested and why they thought they should be tested. We then provided them with several different educational materials, which included lectures, articles, and a literature research list. And then after the test, we did do a post-evaluation study to administer basically to see how effective the materials that we provided were. The second phase of this study involved developing our test kit and collecting samples of museum dust and submitting them for analysis. We did a side-by-side collection with a museum professional and an industrial hygienist to see if they would both get similar results. And then in the final phase, we shared our results with the participating museums and provided recommendations to address the hazards that we found during the testing. So this here just shows you what our current prototype of the test kit looks like. We also created a demonstration video that follows the ASTM method for collecting settled dust samples using wipes. Samples were taken from surfaces adjacent to potentially contaminated objects, not the objects themselves. The wipes were then submitted for arsenic, chromium, mercury, and lead analysis by an AIHA accredited laboratory. One of the reasons we selected this method and focused on the heavy metals is that there are no specific hold times, and they don't require you to ship the samples on ice, which we thought would be a little more straightforward for our museum participants. And then these metals represent common toxins, both used in the manufacture of historic objects as well as applied pesticides. In the final version of the test kit, which we have not made yet, we are hoping that it will include, shipping labels and chains of custodies and everything, so that institutions would be able to take these samples themselves and then mail them directly to the laboratory. So prior to each site visit, we had phone consultations with each one of our participants to narrow down potential locations. Since we were working with a textile conservator, we focused primarily on areas near textiles and other organic objects. We made an effort to collect samples from a variety of different surfaces, such as exhibit fabrics, solid platforms, and a lot of other storage materials. We took samples from a variety of different locations, including both storage and exhibit spaces. And as I mentioned earlier, samples were taken side by side with a museum participant and an industrial hygienist so that we could compare those results. And we included 2 blanks per location. And an industrial hygienist consulted on the proper use of PPE and handling practices while we were collecting the samples. So we use the following criteria to select the locations. We definitely self-selected for areas that we thought would be contaminated by pesticides. We based this on the age of the objects, its collection history, its susceptibility to insect attack based on, the materials it was made out of, and evidence of insect attack. So if it looked like it was in pristine shape and hadn't been eaten by an insect yet, odds are it was treated with a pesticide, and that seemed like a great place to test. We also looked at the construction of the object. So objects containing toxic dyes or mordants, mercury felted hats, natural history specimens preserved with arsenic. The condition of the objects that were in poor condition were more likely to shed contaminated debris, made it a higher probability of the place we would test. And then we also considered the object's storage history, basically surfaces under or near objects that were recently moved, rehoused, or cleaned were less likely to have those sample remnants that we could get to find that pesticide residue. So we looked for things that hadn't been moved for a long time. I'm just going to share just a small subset of the sample results that we obtained during this study. So this comes from the El Pueblo Museum in Pueblo, Colorado. Here, we tested a pair of late 19th century Comanche moccasins that were on exhibit. The moccasins had been in this display case for about 3 years. The moccasins were removed from the display for us, and wipe samples were obtained from the internal stockinette covers that were in contact with the object. Samples were taken from each moccasin, again, one by an industrial hygienist and one by a museum professional. The results came back positive for the presence of mercury, chromium, and lead. So this is a Mexican saltito blanket that dates back to the late 19th century. This particular blanket Paulette, who's our textile conservator on the team, had previously tested, so she knew it had arsenic, and she even vacuumed this, I believe, 5 years ago before it was put in this particular display. So we weren't sure we were going to find anything, but we tested it anyway. We suspected that it had been treated with pesticides, and we knew actually it was treated with pesticides, but particularly because of its pristine condition. This is a 130-year-old wool blanket. The weaving was folded back upon itself so that we could get access to the exhibit fabric. And we took the wipe sample right here off of the exhibit. And it was indeed positive for arsenic. One other sample I want to talk about from the El Pueblo Museum. So this was a trading post that was recreated and built in 2005. The trading post is used as an interactive space. It doesn't contain any ascension museum objects, so nothing that they have tracking and history records for, but it does have a lot of historic props and other educational materials that have been, basically released out of their regular collection. So we took samples underneath the historic furs from the rack on the trading post room and from the floor of the family life room. And we found arsenic, chromium, and lead in both locations. So this was particularly concerning because these objects are regularly handled, or at least were regularly handled by the public, including children. And this is not uncommon. Many cultural heritage institutions, including living history museums and visitor centers, often have hands-on activities with historic specimens. As a result of this testing and our consultations, they decided to, one, they removed all the furs from this area and they decontaminated the rooms, they cleaned them. Then they put them on display in the back and they no longer allow the public to handle them. We also took samples from under hands-on fur specimens from one of the buildings at Centennial Village, which is part of the City of Greeley's Museum's Living History Museum. And again, the results came back positive for lead and chromium. While lead was found, lead was used in the manufacture of many cultural items, such as in pigments, and its presence could also be the result of environmental factors. So depending on the age of the buildings and places that they've been stored in before, they could have, gotten lead from other common pollutants in the environment. So anyways, if you are handling furs from this era, it's always best to assume contamination, wear proper PPE, and then, carrying out testing of the dust in the exhibit and storage space might help you. So the goal of the test kit was to bring more awareness to this issue. It's not a comprehensive risk assessment. The hope is that when one gets a positive result, they might have maybe more success in securing funding from their museum board of directors or the community to address the hazards. Communication can alleviate a lot of the worry surrounding this issue. Most of the time, the recommendations are affordable and easily accessible. The next steps, of course, are specific to each situation, depending on the type of contaminant, the collection, how it's accessed. This slide covers a lot of the recommended steps that we gave to the museums during this study. Particularly hand washing stations after handling materials was a big deal. The next steps, we're going to be working on developing protocols for samples so that people in their museums and hopefully tribal agencies can collect their own samples and get their own results from different laboratory research or resources. We've also received additional grant funding to work with the Indians Arts Research Center in Santa Fe, New Mexico. Actually just got samples sent to the lab today for that project. And then we're working on in a tribally led working group on providing different resources for laboratory analysis. And then as part of that, we have an upcoming webinar series that will be I think the first one comes out in November, and then starting in January through the first quarter of next year on a variety of different topics specifically related to NAGPRA and pesticide testing. So different ways you guys can help is you can join our Museum and Cultural Heritage Industry Working Group and volunteer on our NAGPRA committee. I recommend, if you don't already, connect with your local AIHA section. Here in the US, we have the American Institute for Conservation, AIC, which is a sister organization that we work with in our working group. That's where I met Paulette. In Canada, they do have a Canadian Association for Conservation of Cultural Property, or your local tribal groups who are grappling with these issues. And with that, I think we're ready for questions.